day 20 after surgery.
Day 20 after surgery. And Yevgen, do you remember what it was like for you at day 20 or somewhere around the same time?
It was pretty hard still, you know, because I have my splint on, just like Tanya has hers, you know. So it was hard to talk.
So for you, it's been like almost a year, right?
Year and a half.
Year and a half. But when you're looking at her, are you like getting memories back?
Yes, I'm reminiscing a lot, and I think she's a very brave girl, you know, that she's going through that process, and she's not even.
You actually work in the office, so you see a lot of patients,
Right?
and now you get to live through it yourself. Okay, do you look at it differently?
Yeah, I feel like it's not as big of a deal as I thought it would be.
Oh, really?
I mean, I'm the kind of person, I was preparing for the worst. I'm not saying it's easy, but it's not as hard as it seems. I feel like this might seem like it's a little bit harder than it really is.
Yes, it does.
Maybe because like I'm in the recovery mode and I have this attitude, this is normal, this is good, let's get this done with. And I was expecting this. I asked you so many questions what to expect, and it helped a lot. But so for now, I feel like it's easier and it's going by a lot quicker than I was initially expecting it to.
Mm-hmm. You're not even supposed to be back in town. Right?
I'm not. Was not supposed to come back to town until March 2nd. And I flew back from Moscow on February 12th. It was just, I felt like I was ready to fly. I was ready to go. Moscow's really cold at this time of year. My lips were not healing. Like, my lips had it really bad. I think they kind of tore over here during surgery because they did a lot of bone graft on this side. So anytime I would step outside, because I'm not a stay in bed kind of person, it is just very hard to ground me. So anytime I would go outside, they would just crack from the frostbite, and then of course I got a nose job, and I'm just like thinking, all right, well, I'm getting frostbite on my hands. Is my nose gonna fall off right now or not? Let's get back inside the house. So I was just not having it in the cold.
Yeah, do you have any questions or suggestions for her?
No, actually, she reminded me that I flew back to my town 1 month after surgery. And I remember that I was worried too, you know, about traveling, should I be moving a lot. And everything was fine, you know, I was active, pretty active. 1 month post-op, pretty confident about running, you know.
Anything you could suggest to her at the stage she's in right now?
She definitely should stay away from solid foods, you know, because her jaws are still healing up, so just bear with the liquid diet, you know.
Yeah, I'm trying. Well, I still have a splint, I can't even chew.
Yeah, once they take out that splint, it'd be so much easier for you to clean your teeth, you know, your brackets. Yeah.
It's like so hard. It's impossible. I always like squeezing them. The water pick helps, but then I feel like sometimes it's too hard, and sometimes I'll cut through the stitch and I'll bleed.
Yeah.
So I'm trying to like set the pressure on the lowest with the water pick, but it's just so annoying. This thing is just so annoying.
Yeah, but make sure you do clean it well, because you don't want any infection. Right?
Yeah, that's worse than anything.
Yeah. I remember that was the hardest part for me too. Cleaning after food, you know, it was the toughest thing to do.
I know, sometimes it's easier to go hungry.
I know, right?
Honestly, sometimes it's like, no, I'll just wait. It's not worth it. It takes like 45 minutes to go clean your teeth after every meal. You're always hungry, so you kind of try to choose and pick when to eat. Do you have time to eat and then go clean your mouth or not? Like,
yeah, you both had the same surgeon.
Yes,
right?
We did have the same surgeon, Dr.Antipov.
Yeah, so I mean, Yevgen has told us how he was. Dr. Antipov has made it very comfortable, and he stayed in touch. Of course, he had to go to where he came from. But you're in town. Tell tell us your experience with how Antipov helps you recover.
He was there from day one, even because he flew with me to Moscow to do my surgery, and before he left, he made sure I was stable. He would visit me there a couple times a day, make sure that I'm good and that everything's good. And when I flew back in, I was feeling from the flight, because it's a 12-hour flight from Moscow to LA and then from LA to Sacramento, I had a lot of pressure in my face. So I was a little bit worried, and it got my head was hurting right here, and just the pressure built up probably from the high altitude. So I texted him. He's usually always available via text with patients that he treats with orthognathic surgeries, because he takes that very seriously. So I told him, and he said, so just come in. I came in like first thing in the morning, because I flew in kind of late, and he checked me, made sure everything was fine, and I go to the PO text regularly, and tomorrow I get to see him, so hopefully the splint comes off tomorrow. Fingers crossed.
Do you guys want to compare like how your friends and family are reacting to the stage you're in right now versus like how your friends and family were reacting? Or earlier you were saying how a lot of your friends and family were against it.
Mm-hmm.
And yeah, and you decided to go through with it anyway. I know one of your cousins was not exactly for it.
All of my family was like, no, you don't need this. I mean, they weren't like, no, you can't go get it done. Like, no. But they're like, they tried to talk me out of it. But
same here. Same for me, yeah. They were not strictly against it. They were just, suggesting that you normal. You don't have to do it.
They were worried.
Yeah. They were worried. My dad cried. Like, well, he didn't like cry like sob, but he had tears in his eyes when he was saying goodbye to me. Cause he's like, you just have no idea what you're putting yourself through. I'm like, yes, I do that. I did my research. I'm good. And even that now, like, she said they're very happy that I'm back, because they were very nervous when I was back there. They're handling it pretty well. I don't see them a lot. I've seen them maybe 2 or 3 times since I've been back.
Is there anything that you would want to ask Yevgen?
Just because I still don't have feeling in a lot of my face. So how soon did you start getting feeling back?
I would say after 6 months, everything should be fine. The swelling is gonna go down, and then the numbness should leave you. I think that's exactly when I started feeling my skin.
6 months?
Yeah, 6 months.
Really?
Some areas, like around this area, I feel like I'm still numb a little bit. But everything else is gone, so it depends on the person. But the major part should be gone by 6 months.
I feel like this side of my face, I have feeling back well, except like this part, I don't have it back. This part I do, but this side no. And that's normal to have one side not have feeling yet.
That's exactly how it was with me.
Because I know that they did a lot more work on me on this side over here. I guess my jaw was like this, so my upper jaw was like this. So when they cut it, they have to kind of level it, and I think all of this here is bone graft, the way that I understood it.
Well, after a year and a half, you'll definitely feel like everything belongs to you, and nothing was.
Yeah. Even my fake little nose top.
That I don't know. I didn't have my nose on, so I'm not gonna speak for them. But the jaws and the bone graft, bone cheeks, or whatever material they had to put, is gonna feel like it's yours after a year and a half.
Yeah, the jaw, I don't feel the jaw because I think they extended it quite a bit. According to the CT scan, it's like this much, and it's just kind of like hanging there, well, it's screwed or something. I think bone in between, I don't know what's the first, I mean, I try not to feel it too much so I don't mess it up.
Definitely no boxing for you.
No boxing.
In the next year and a half.
I like kickboxing.
So, like, just watching you guys talk, just the way you talk right now, with all this going on in your mouth, sounds like you're trying to talk through something. Is this the same?
I had exactly the same pronunciation. you know, try to catch my spit last minute, not to fall out of my mouth, you know, and have to do this every like 10 seconds, you know. So I know I might have forgotten that feeling already, but you know, once I see
you know exactly
Tanya,
what you're
I know exactly what she's going through.
She's a rookie.
She's a warrior.
The slobbering got better. Like the first few days, it's just another thing where I left Moscow. I just going outside, like trying to go grocery, like to a store shopping, because you're just like a slobbering little puppy. Like you have stuff drooling down that you don't even know. Like my caregiver was like, "Sure, you need this." I'm like, okay. Or like in the airplane when I was flying, I would like look up and then like I could feel like people like staring at me, and I'm just like, wait, like, oh man, this sucks. Like, it was bad, but now it's kind of under control.
Mm-hmm.
It's finally under control.